We're going to repeal and absolutely repeal and replace ObamaCare.
Repeal and replace Obamacare.
Repeal and replace Obamacare. Repeal and replace Obamacare with something so much better.
We all heard it over and over. It was one of President-elect Donald Trump's main campaign promises. But what does repealing and replacing Obamacare actually mean for you, the patient and the American? For a doctor's perspective, is joining us now radiologist at Memorial Sloan Kettering, Dr. Nicole Saphier. Thank you, doctor, for being with us.
Good morning.
Good morning. So what are the negatives of Obamacare?
So prior to the Affordable Care Act, we were holding steady at about a 16% uninsured rate. Since the implementation of the ACA, that number's dropped to about 10% in 2015 and slightly lower early 2016. As 20 million Americans now are newly covered by insurance companies, we're finding very quickly that we're ill-equipped to deal with this work burden as well as the financial burden that is put on us. We're finding businesses are actually needing to hire fewer people to offset what they're having to deal with the ACA costs. We're also in the midst of a physician shortage crisis and physician burnouts at an all-time high.
Is that because of this? Because now doctors don't want to go through the process of going through medical school because they're not making as much money because of things like Obamacare?
So there are several reasons. Some of it is 20 million newly insured people means 20 million new patients coming through the doors. We're already at a 20,000 physician deficit. It's been projected that this number will quintuple over the next decade if things stay on course.
So you're seeing more patients on a daily basis and you're not able to spend as much time with your patients as you'd like?
Absolutely, decreasing quality of care and face time with physicians and patients.
Well, from a doctor's perspective, what's the message you want to tell Donald Trump if he's watching this morning, and he does watch our program? What would you like to see change? Why replace, first of all?
Well, replacing Obamacare is not something that can be done overnight with a sledgehammer. We're going to need the fine precision of a scalpel in order to make something successful. We need to focus on the strengths that the ACA has provided us, which is increased coverage, inclusion of patients with pre-existing conditions, and keeping our children on our health care plans until the age of 26. Now, these are extremely hefty provisions to keep. They're very financially burdensome. So what we need to do is we need to increase interstate exchanges with the marketplace. We need to utilize health savings account. We need to decrease federal mandates in an effort to increase health care innovation.
What are the concerns of your patients?
Our patients are seeing less face time with physicians. They're seeing that they're having to go to more mid-level providers, nurse practitioners, physician's assistants, which are huge aspects of health care and are vital to us. However, patients are not seeing their doctor anymore. They don't even know who their physician is. The incumbent and incoming legislatures have a huge opportunity to increase the quality of care while decreasing costs, all while empowering patients. And I truly hope that they're going to be able to do it.
All right. Is there a solution?
We'll see.
Any advice that you have for our congressmen that are watching?
I do truly believe that including doctors in the discussion, which is already taking place with having price involved, is an extremely important strategy.
All right, good deal. Thank you so much. We wish you all the best.